Hello everyone, this is Dr. Sushma Sarila, consulting homeopath at Fidicus Homeopathy, and today we are going to discuss about adrenal PCOS. What is this adrenal PCOS? You have to remember first what is adrenal gland. So adrenal means adrenal gland which is located on the top of kidneys. Like for example, if this is right and left kidney, we will be having adrenal glands on top of the kidneys, right? And adrenal glands release certain hormones in stress conditions, okay? So these hormones are something that are causing this PCOS symptoms. So what are the hormones that are causing PCOS symptoms? Adrenal PCOS is a subtype of PCOS. It's a health condition where the adrenal glands are responsible for the overproduction of androgens. This is very, very important. See, adrenal PCOS means that there is overproduction of androgens by the adrenal gland, which causes PCOS-like symptoms. Why does it cause PCOS-like symptoms? Because PCOS also has hyperandrogenism. PCOS is a triad where any of the two in a triad, if you are if you are having any of the two in the triad, that means you have PCOS. What does the triad constitute of? The triad constitute of first pi category, which is P for polycystic ovaries, I for irregular menses, and E for excess androgen or hyperandrogenism. So even in adrenal PCOS, we have hyperandrogenism without any involvement of female reproductive system. So that is why, because of this hyperandrogenism, there are PCOS-like symptoms developing. So now let us know what are the hormones that this adrenal gland releases and how do they affect the body. As you can see here, adrenal PCOS is a rare condition, but the cases are growing day to day. Why do the cases grow day to day? Because of the lifestyle disorder. What is the lifestyle disorder that is triggering this adrenal gland? That is nothing but stress. So whenever you are under stress, what do you mean by stress? Stress, if you are hearing about something or a stressful event, if you are seeing a stressful event, if you are experiencing some lifestyle changes, or if you are having chronic sleep loss, or if you are having insomnia, if you are having a lot of desk job and you're not moving, if you're just eating fat food and you're emotionally wrecked, then that means stress. Okay, whenever you are stressed, what happens? The body or the brain itself is activated, and there is a region in the brain called the hypothalamus wherein it releases CRH. So whenever you are experiencing stress, the body or the brain itself is activated where the hypothalamus releases CRH. Okay, and then the CRH triggers the pituitary to release ACTH, and this adrenocorticotropic hormone, what it does is, this is the adrenal gland which is situated on the top of the kidney. This adrenal gland will be releasing two types of hormones. One is called as DHEA and the other one is called as cortisol hormone. So as you know, cortisol hormone is released under stress. It can be acute or chronic stress. If it is acute stress, it is helpful for the body in evaluating, it helps in cognitive function. But if it is chronic manner and your cortisol is being released in a chronic fashion, then it does cause immunity problems and it causes other problems as well. We have discussed all of that under fibroids and stress topic. So if you want to check out about stress and how it affects the body, we've already discussed it. The link will be provided in the description box. You can go and check that out. Right? So today we are not talking about cortisol, we are talking about DHEA. So under stress, the hypothalamus is triggered, hypothalamus triggers pituitary, pituitary triggers adrenal gland produces two hormones, which is the DHEA and the cortisol hormone. So what does this DHEA do and why is it harmful for the body? So remember, DHEA on a lower rate is not harmful for the body. DHEA is a precursor of androgen or precursor of testosterone. Okay, it directly does not release testosterone. It releases DHEA sulfate, okay, or DHEA-S, that is what we call it. Okay, so this DHEA is converted into androgen under bodily conditions. Whenever body needs a certain thing, it is converted. Okay, but what happens in this adrenal PCOS is that there is a lot of DHEA releasing, and this DHEA is converted into DHEA sulfate is released, that is converted into DHEA into androstenedione, and that is into testosterone. Okay, so this testosterone accounts for the hyperandrogenism characteristics. So what are hyperandrogenism characteristics? We will be discussing as we go through this topic. You have to remember that adrenal gland is releasing a precursor for testosterone and the testosterone is being increased. So what happens in PCOS is that the contrary factor, here adrenaline has no issue with the ovaries of the body, right? But here what happens in normal PCOS is that due to brain releasing a lot of GnRH hormone, the GnRH increases the luteinizing hormone. The luteinizing hormone triggers the ovarian fecal cells and they produce DHEA directly, and they account for 20% of DHEA, 50% of anistrandone, and 25% of testosterone. Okay, and this is again converted into testosterone. The precursors are converted into testosterone. So here ovaries are being affected because of high luteinizing hormone. Your adrenal gland is being triggered because of stress. If you're someone who's suffering from PCOS or any other female reproductive organ diseases, Fidicus Homeopathy is the answer. Here we have two kinds of consultation options. One is online and one is offline or in-person consultation. If you're someone who's staying away from us or far away from us, you can contact us online, either through audio consultation option or through the video consultation option. And if you're someone who's staying nearby the nearest branch of Fidicus, you can contact us in person. After the doctor consultation and the investigations, after being verified, and then after taking case, especially to the online clients, medicines will be door delivered to you. If you're staying in India, it can take 3 to 4 business days, USA 3 to 5 business days, across the globe, anywhere it can take 4 to 8 business days for our medicines to reach your doorstep. If you would like to get in touch with us, you can call us on this number, WhatsApp us or messages. And if you would like to know more about Fidicus Homeopathy, you can check our website www.fidicus.com. Here we have discussed why homeopathy is the best choice for PCOS or any lifestyle disorders as such. Here we will be discussing how Fidicus Homeopathy is the best choice of your clinic. See, Fidicus Homeopathy stands on principles. It stands on highest chance of health. Here, we are experiencing high success rate in people who have already suffered with PCOS, PCOD, endometriosis, adenomyosis, bulky uterus, fibroids, dysmenorrhea, and other female reproductive organ diseases. And second thing is that the treatment that we give here is transparent. That is, there is no gray area between the patient and the doctor. The prognosis will be clearly explained to you. And the third thing is the personal care. Here at Fidicus Homeopathy is top notch because we will be answering all of your queries and your questions, and we'll be busting all your myths. We will be educating you on your condition, on what to eat, what to not eat, what to do with the condition. So if you want to choose cure, if you want to choose health, choose Fidicus Homeopathy. Thank you.